Coming up, we'll be on location at Charm City Integrative Health in Baltimore, Maryland, discussing the benefits of integrative health and wellness and how they can effectively treat many health problems and improve your overall health and well-being with one of this region's top integrative health specialists, Tom Ingenio. Tom is a licensed acupuncturist and is the owner of Charm City Integrative Health, and his practice is widely recognized as one of this region's top integrative health and wellness clinics. Welcome, Tom. It's a pleasure having you on our program.
Thank you for having me.
It's your first time, in fact, on the Top Doctors interviews. We have a lot to talk about. We have a few patients that we're going to be hearing from later, not to mention some treatment footage of some of those patients with the various treatments you all offer. And I wanted to begin by asking you, Tom, if you could please tell us about some of the most effective treatments available within integrative health and wellness that you offer here.
One of the things that we do here, and the whole foundation of what we do here, is really based on how can we help people stimulate their bodies to work better. We wanted to base things off of my main service, which I've been a licensed acupuncturist for 16 years now, and we wanted to add things that could complement that yet be standalone therapies. Yeah. So, from a Western perspective, acupuncture does things like increase circulation and reduce inflammation. And if we do that for most people, regardless of what they're coming in for, they should feel better. So we picked services like whole body cryotherapy, hyperbaric oxygen, salt therapy, massage, and nutrition, and all of those in their own way can help improve the quality of blood, circulation, and reduce inflammation, helping people heal naturally.
Very interesting. And I know you have all these wonderful therapies and treatments that you just touched on that you offer, and I take it you all customize each of your health and wellness programs to each individual patient to best fit his or her needs and get rid of whatever's ailing them or get them back to where they want to be.
Oh, definitely. Treatment plans should be living, breathing things, and they should evolve with the patient. So if we put together a plan, say we'll try the cryotherapy twice a week, maybe massage once a week, and see how you're doing. If we're getting great results, great, we can go forward with that. If we need to change it up, add something, slow it down, speed it up, we have the ability to do that for each individual that comes in here.
Now, speaking of acupuncture, which you mentioned a few moments ago, yes, I wanted to ask you if you can please tell us a little bit more about that particular treatment that can help and does help so many people. I mean, it's the oldest, most ancient, therapy to help people get better. And can you please tell us about it? Because most people don't realize it's not just for people suffering from pain.
No.
It can help people in a wide range of areas.
Yeah. So acupuncture is actually a complete system of medicine that, as you said, dates back thousands of years. And what we're trying to do is correct underlying imbalances, not just go after symptoms. So the idea is that, yes, we can help you recover from injuries. We can help you recover from headaches, inflammation, all these things that may be a symptom of an underlying imbalance. But at the end goal, we're trying to rectify that underlying imbalance and get your body running optimally on its own.
And what specifically are some of the folks out there that can benefit as far as like people suffering from neck pain, back pain, leg pain, and other problems?
So we see a wide variety of people, all different walks of life, all different conditions. That may be somebody that just wants to be able to get their mail from the mailbox at the end of the street without pain, to top-level athletes that are looking for that competitive edge. A large percentage of people that are coming in are suffering with things that are a little bit more mysterious. Autoimmune diseases, inflammation and issues intestinally, gynecologically, and we can help because we are aiming at that body as a whole person.
And also regarding acupuncture, Tom, you know, the perception, even though it's changing over the years as acupuncture has become very popular now, but a lot of folks still associate it with, they imagine long needles and pain and things along those lines, but that's not the case.
It shouldn't be. There are many different styles in acupuncture. Acupuncture is a living, breathing system that's been evolving over thousands of years. And with that, needles have gotten much smaller and thinner. Particularly different styles tend to want to do the most with the least amount of stimulation. So preferably, we want you to feel very little during the treatment. Occasionally, you could get some sensations like tingling, warmth. They should be pleasant. Pain is not something we want to have associated with acupuncture.
Yes, indeed. Now, I wanted to also ask you about cryotherapy, because you're literally like the first cryotherapy center here in the entire Baltimore region, and we're very proud to be here and feature that as well. Can you tell us about it?
Yes, we're definitely the first in Baltimore City. I think it's one of those things when a good idea hits, it hits everybody at once. So we can't claim first in the state, but we know we're one of the first in the region. And cryotherapy, this is another thing that's new and famous in America, right? Mm-hmm. But it's actually been around since 1978. Mm-hmm. And it dates back to that time when a Japanese physician was looking for relief from rheumatoid arthritis. Now, systemically, what happens in cryotherapy is we get blasted with this intensely cold air, and we don't shy away from that. Yes, it is cold, but that cold is not for the sake of cold. The cold causes constriction throughout the whole body. So the skin tightens, the fascia tightens, the muscle fibers tighten, the blood vessels constrict, and the joint spaces get squeezed. And what that does is push inflammation that's in the body, in those tissues, back to the center where they can be processed and gotten rid of. And then when you come out, you get this amazing effect where your body wants to warm itself up very quickly. So all those blood vessels open back up, getting fresh blood into that tissue and promoting healing.
Very interesting. It's taking the old, what we envision, the ice bucket treatment, mm-hmm. right? Or in the ice tub that a lot of athletes typically associate with jumping into something cold to recover from, to a whole different level.
Definitely, and it's much quicker. And a lot of studies are indicating that this is a much safer method.
Can you tell us about some of the other treatments and services that you offer that are also helping so many folks?
So we looked for things that might be a little bit harder to find in and around the state because we wanted to make them accessible to everybody. So we have mild hyperbaric oxygen therapy, and we have a salt cocoon for individualized salt therapy.
And can you tell us about that?
Yeah, sure. So salt therapy has its origins thousands of years ago as well. It oddly was prescribed back in ancient Greece, where they'd send people with respiratory disorders to go sit in caves. Now, in the 1890s, a Polish physician in a salt mining town discovered that not only did the miners not get normal diseases associated with mining, but they were healthier from a respiratory perspective than the average individual in that town. Now, he theorized that it was this microfine salt that was floating around in the air. Our salt cocoon mimics that environment by grinding salt down to a microfine dust and circulating that around your body. You don't smell it, you don't taste it, but slowly over the half an hour you're in there, you'll feel your sinuses opening up and your lungs actually opening up as well.
For these various treatments that you just told us about, Tom, I know it depends on each patient, his or her situation. Not everyone's the same. But by the same token, for folks watching right now, can you give us like an idea of how often you recommend them coming in initially, for example, with acupuncture?
Well, once again, this comes down to where we want to help people as much as they want to be helped.
Sure.
It is not more is better here, depending on whether or not the condition is acute or chronic. If it's acute, we want to jump on it. We want to see you more frequently up front. If it's chronic, it's going to take some time to undo. Everything we do here is a therapy. It's not a magic bullet. We're not offering anybody a miracle. We are offering them a consistent therapy plan that can help them get the results they need, and that's going to be as individual as possible.
Yes, and I would think with acupuncture treatments, your patients are looking at what, typically an hour or so for each session?
So yeah, an acupuncture session is typically about an hour. The first time we block off an hour and a half for you. So not only I can ask all the questions I need to give you the best treatment possible. You can ask and voice any concerns you have as well.
Sure. And with cryotherapy, I understand that's only a few minutes long, right?
I say that's the biggest bang for your buck. You're in and out of here in 3 minutes. 3 minutes is the maximum time where you get the maximum effect, and we make sure that you have a good time.
They can come right in during work or during lunchtime?
We have plenty of people that do that. We have plenty of people that come in right before work because, like I said, it is a quick therapy. The cold will wake you up and get you going for your day.
Absolutely.
And then we have plenty of people that want to come in after work and don't want to hang around for hours.
Absolutely. And as far as the salt chamber that you're telling us about,
Yes.
can you tell us a little bit more about that? Like, again, how long would that session take as well?
So those sessions are a half an hour.
Okay.
And during that time, it's like getting breathing in the beach air for a whole day in 30 minutes. It's concentrated, but it's comfortable. Like I said before, you don't smell it or taste it, but you will feel the effects after a session or two.
And as far as your oxygen therapy, can
Yeah.
you tell us a little bit about that, Tom?
So we have here a mild hyperbaric oxygen chamber, and that takes you down to, and down to is because we put it in pressure, so it's about the equivalent of being 8 feet underwater. And at that pressure, now you're not wet, it's pure room air that's pumped in there, but at that pressure we're exploiting a physics principle called Henry's law. And that says when a liquid is under pressure, it can absorb more gas. So we're absorbing more oxygen into the liquid part of the blood. Walking around healthy, your body should be about 98 to 100% saturated with oxygen on the red blood cells. However, when we increase the pressure, now you have additional oxygen floating around in the liquid part of the blood that can exchange with any tissue that needs it. So it is promoting whole body wellness or whole body healing via that route.
Absolutely. And in fact, it's what you touched on a few minutes ago. All your various therapies and treatments that you all offer to all the patients in this region really all, I would say, complement each other very well.
Yes.
All integrated beautifully towards helping each and every one of your patients really achieve the total being that we want to achieve in health and wellness.
Yes, there's thousands of amazing treatments and services out there. Our goal was to put together a few of them that make the most sense, that can help the most amount of people, and do it in the least invasive way.
That's the best combination.
We're trying.
So I understand you all offer not only wonderful treatments and therapies that you've told us about, but very realistic results and outcomes that were in line with what you initially talked about with each of your patients during the initial consult of what they wanted to achieve and how you could help them get there.
So we're not promising anything, but we are working with tried and true methods to help your body respond better. Every time somebody comes in, we want to listen to every complaint they have and set up a plan that can help them. Hopefully we can give you a realistic expectation about how long things should take and about what your results will be.
We're now going to meet some patients of Tom in Charm City Integrative Health. Welcome, Mark. It's a pleasure having you on our program.
Thank you. The pleasure is mine.
We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, I'd like to begin, if I may, Mark, by having you please tell us what problem or problems were you experiencing that brought you here to Tom and Charm City Integrative Health?
Sure, absolutely. Thank you for asking me. I was having extreme difficulties in flexibility. There was constant shaking in the hands, extreme headaches. In addition to that, I was starting to have memory loss. And along with that memory loss, there were many stroke-like symptoms that I was undergoing, such as droopiness of the eye, my mouth. I had a slurred speech. It was very hard for me to even drive a car because of the positioning that is required to be in a vehicle. My back and the lower back muscles were becoming even more and more impaired.
some very debilitating problems you were experiencing, Mark.
Yes, yes, there was. And what made it even more frustrating is the fact that I am a former athlete, and having somewhat of a competitive spirit and kind of being a go-getter, if you will, it was extremely difficult, and not being able to play with my children in the manner that I wanted to, not being able to be as active with my wife as we would like to be, going to the park, taking bike rides, things of that nature. And so we came together, put our heads together, and spoke to our primary physician, who was convinced that I had MS. And even though the tests were always showing a result of negative, he was still convinced that it will be just a matter of time that these tests will come up positive, that you do in fact have MS. Well, as my wife and I kind of, again, put our heads together and realized that perhaps maybe there should be some type of alternative treatment that we can do just to minimize the pain and at least make me a little bit more comfortable as we prepare ourselves for this kind of heartbreaking news, if you will.
Yes.
And through research, we found Tom. And the consultation that I had with Tom was extremely refreshing. He made the Eastern philosophy and the medicine that is practiced, that is normally complicated to explain, extremely simplistic. And he broke down exactly the variety of patterns that the acupuncture, the needles within acupuncture practices can be displayed on my back and lower back, as well as areas on my hand and arms and things of that nature. And so I felt extremely comfortable with him. He had a very warm and personal personality, and we tried it. And slowly but surely, we started to notice a decline in the pain, an increase in flexibility. I started to notice how much more engaged I was. My level of, my profession is I am a federal employee, in which I deal with analytics and financing at a great capacity. And I noticed how engaged I was in doing more than I had been doing. And so that particular 2 to 4 week time period turned into 6.5 years. And through that period of time, because his methodology in approaching not just in acupuncture, but in other procedures such as cupping and moxie as well, different types of pressure points within the back and abdomen, there was never a consideration of kind of going anywhere else. So ultimately, alternative medicine became now my primary physician.
Well, we are so happy to hear that. The pain is gone. You're able to drive without any problems.
Yes.
Not to mention play with your kids. You said you have an athletic background. And
I do.
Are you back to doing all the things you were doing before?
I am, and as a matter of fact, even more. Because at one point, like any patient, when you are trying to recover, the mind is also such in a kind of a disabled state, because you're always reflecting of the pain and you become reflective of what could happen. And after a while, you start to then trust this new rehabilitated body, this new rehabilitated form of flexibility. And it allows you to stretch, and in hindsight, the imagination comes back as to what else can be done, what else can I do, how much more can I work. And because of that, I've noticed, even with my children, it's a matter of me turning back into the night owl that I used to be, where I can stay up much later and be much more enthusiastic about plans for the next day.
That's wonderful.
And Tom has a lot to do with that.
Yes, indeed. Mark, we're so happy to hear that. As I mentioned, obviously you sound like you're extremely pleased with the results.
I am, very much so. It's amazing because we used to live closer to his facility, and we were fortunate enough to buy a larger home because the increase of numbers of children that we had and our family was growing. It never occurred to us that we had to change our physician or change the location and the proximity of what it would take for us to drive down Route 95 to get to Tom. That never was considered. It was always a matter of everything else would have to change, the schools, the route to work. But in getting the treatment that I was so comfortable with and, in my opinion, needing of, that was just something that we just knew we had to calculate, that we're gonna have to still go there on a bi-weekly basis. And it just kind of turned into the fact that this man has literally created a dialogue that was never there before, not just with myself and my wife, but to extended family members who had other health problems in which I could recommend Tom for their service or for his services.
Absolutely. And in fact, touch on what you just mentioned here a moment ago, you moved out of Baltimore to back to
Maryland.
Columbia, Howard County, Columbia, Maryland.
That is correct.
So you've got a little bit of a drive, right?
Absolutely.
But it was never a question of whether you would look for another Eastern medicine acupuncture practice other than Tom because of the great results you've experienced and the rapport you have and the trust and comfort you have with him.
Absolutely, and to quantify even what you're speaking of, the alternative has actually become the normal. It has become, he is now, in our sense, the primary physician. If I were to now look for, I would have to look for a primary physician where a lot of the symptoms that I could encounter, if I'm having massive headaches, if I'm feeling a little bit stiff, I'm almost shaking my head when I see other people looking to reach for medicine cabinets and finding pills to take, or looking for some doctor that they heard from word of mouth. And I'm saying to myself, wow, I have the entire package based upon the abilities and the knowledge and the content that he's able to actually convey.
Yes.
So it's a very big privilege for me.
So let me ask you, Mark, I take it the MS never materialized, that the primary care physician had told you, what, 6+ years ago, 7 years ago, that was basically inevitable, and that was the reason you were experiencing all those problems?
That is correct. And as a matter of fact, because I was lacking the symptoms that would support me possibly having MS, it was just a matter of stating, well, we're not quite sure what he has.
Yeah.
We just know he feels better.
Yes.
And I think that despite of any kind of degree one can get, I think common sense is always a very healthy level of intelligence to have. And it was a very practical, and it was common sense for myself to continue to go back to Tom, to continue to get treatment. And not just treatment too, but also the dialogue, the level of conversation that he's so open. He's very transparent in explaining how the procedure is not just to apply, but how you're supposed to feel, not just at this moment, but days later, weeks later,
Yes.
and the possibilities and the variables that could come across when performing certain procedures that he's able to do. And I find that to be extremely refreshing, whereas in Western medicine, oftentimes you're somewhat categorized and it can be interpreted as somewhat of a warehouse form of medicine.
That's right. No, you're absolutely right. And again, as I said, I'm so pleased to hear that you've been pain-free for several
Right.
years. You're coming every 2 weeks, as you mentioned a few minutes ago.
I do.
For a tune-up acupuncture treatment.
Absolutely.
Just to maintain and to
Absolutely.
keep the energy levels up. And before I let you go, Mark, is there anything else you'd like to add for our viewers?
Sure, I would just, if anyone, for those who are watching, I would simply just encourage people to really not just give acupuncture a chance, but challenge the acupuncturist. I recommend Tom with my full heart and my full level of intelligence that people really embrace acupuncture, but most importantly, embrace the acupuncturist, the person who is performing this procedure.
Yes.
As I mentioned earlier, I live in Columbia, so you're talking about a 30 to 45-minute commute depending upon the traffic.
Yes.
It is well worth the drive. You much rather would want to drive for a long period of time and feel better than to drive 5 minutes around the corner to a primary physician and leave with questions, worry, and not have the peace of mind in knowing that I can have a long, healthy life and an engaging life that is not limited or handicapped by abilities that I'm not able to explain. And I believe that for those who are watching this, be encouraged to realize that there are in fact practitioners who personalize this medicine and really take you as the patient as somebody that is personal for them. He treated me as if my last name was his last name, and that was extremely refreshing.
Absolutely. And on that note, I want to thank you, Mark, for joining us, sharing your experiences.
Absolutely.
We're so happy to see you back to your normal self,
Yes,
and even
yes.
more so.
Yeah, I was about to say, even more so.
Absolutely.
Thank you. The pleasure was mine.
Thank you. Welcome, Sherry. It's wonderful having you on as well.
Thank you.
What brought you to Tom and Charm City Integrative Health?
I've been suffering with positional vertigo, vestibular migraines without headaches that cause dizziness for years. I've been to prestigious hospital right here in Baltimore and seeing different specialists. I was going once a week to rehab, trying different diets, different medications, and nothing really seemed to work. And my rehab person mentioned trying acupuncture and recommended Tom, and that has made the difference in my life.
So Tom was referred to you through your rehab person, as you
Yes.
mentioned, and then you came here, and what happened?
It took about a month, but my energy level is totally different. I have not gotten any dizzy spells. I mean, I can't say enough. He has totally brought my life back to me, really.
Oh,
I mean, I come weekly, and it's just, my life is totally better.
yes. Oh, we're so happy to hear that, Sherry. You've got, like you said, I feel your energy, your smile, your personality. I met you
Thank you.
before our segment here today. My goodness, I wouldn't imagine that.
A year ago,
Yes.
I would have been a different person. I was lethargic, that I was depressed because of the issue and just everything. And,
Yes.
And
how often do you come again,
I
Sherry?
come every week.
Okay.
He says I don't have to, but I want to come every week.
Yes. And how long is the session for?
Usually lasts about an hour.
Okay. Okay. And you feel great? It's just like a little tune-up maintenance to keep you where you are, right?
I'm afraid not to come anymore because, like I said, it was the difference in my energy level my whole life. I mean, there's no words to describe it for me.
And before we let you go, Sherry, is there anything else you'd like to add about Tom and his staff here?
I've only really met Tom. I love talking to him. His knowledge is unbelievable when it comes to Chinese medicine. And I love picking his brain. I just wish there was more time to do that,
Yes.
because he really knows what he's doing, what he's talking about.
Well, on that note, we'd like to thank you, Sherry, for joining
Thank you.
us and being a guest on our program.
Thank you.
Welcome, Brian. It's nice having you on our program.
Hi, nice to be here.
Thanks for taking the time and coming down to join us. And I wanted to begin by asking you if there was a problem or problems that you were experiencing before that brought you here to Tom and Charm City Integrative Health.
Yeah, I'm a power lifter, and frequently I would have a lot of inflammations with my muscles. And I've heard about cryotherapy where it would relieve inflammations. So I gave it a shot, and that's how I found out that that we had a facility here in Baltimore, real close, because I've seen it in California on TV and through TV shows. I said, oh wow, we have one right here, and it's really not that far from me. Let me give this a shot. So that's
Yeah, I believe that's the only cryotherapy center here in Baltimore.
as far as I know.
Yeah, so what happened? Then you came here?
Yeah, I came here. I actually came here on one of the online deals, and I said, oh, let me just try it because it was cheap, and I'm like, what do I got to lose? But possibly just good health. So I came down, and I was put in the tube. It was cold, but it was a nice allure saying, okay, I went to sub-0 degree temperatures, and I came out, well, let me backtrack. Before I was real stiff. I couldn't bend down to pick up, anything off the ground. So I did the cryotherapy for the 3 minutes. I came out, I was able, no pain. I went right down to my foot.
Oh, wow.
And I was very, very happy. It was a wild feeling, I just felt very upbeat when I got out. And I guess from what Tom told me, he said this, a lot of your body's releasing endorphins, and the rush of the warm temperatures, you're getting that sensation. I'm like, I like that. But the more importantly, I didn't have any pain. It was like a body reset. So I was able to go back to doing my weightlifting, the very next day. And everyone's like, "What'd you do?" Like, I was in cryotherapy.
Yeah, and you said the cryotherapy session only takes a few minutes?
Yeah, it took 3 minutes.
And you felt immediate results from what you just said?
It was wicked. It was 3 minutes, and it was as if I didn't even hurt myself. It was very, kind of one of the things where you have to experience it to believe it, and I experienced it. And I've been coming back, weekly, bi-weekly, so.
Just to keep everything the way you want it to be?
Absolutely.
Because you're an athlete, you're a weightlifter,
Yes.
and you were able to go right back to weightlifting the next day, you said, after your first treatment.
Absolutely. It's wild. It's very, very, I didn't believe it at first, and I tried it, and I felt great.
Well, we're happy to hear that. And before I let you go, is there anything else you'd like to add?
I would like to just add this, if you haven't checked out Charm City Integrative Health, just come on down and try it. Try one of Tom's, the sessions on, whatever he has to offer. And he's very knowledgeable with everything too, which is the other thing too, because in the tube, it's very, very cold. It's almost, 275 degrees below zero. It's very cold, but he talks to you about the entire process. He tells you the benefits, what you're getting out of it, and before you know it, you're done.
Yes.
And it's the knowledge that he brings with everything that makes you feel very, very confident in his practice. Makes you feel very confident that you're being taken care of. And it's very inviting, and it's very easy to talk to. It's like he's like I've only been coming a few times, but he's a good friend.
I'm happy to hear that as well, Brian. And on that note, we'd like to thank you for joining us, sharing some of your experiences, and being a guest on our program. It was a pleasure having you on as well.
Thank you.
Thank you. We're now back with Tom. The patients are very happy with the results. Some great work, Tom.
Thank you. I mean, at the deepest level, our goal here is to help as many people as we possibly can. And, yes, we've got some amazing services. Yes, we've got an amazing team. All of us are passionate and really want to be there to help as many people as we can live better lives.
Yeah, and I mean, look at Mark, for example, our first patient today. Mark's primary care physician 6-7 years ago, prior to him coming to see you, told him that she believes he has MS. And it was just a matter of time, even though the tests kept coming back negative, that he was going to end up having MS. He comes to you, and here he is 6 years later, healthy, happy, energized, being what he was when he was younger, and playing with his kids and driving without worrying about whether he can become impaired and can't drive anymore. And that's just one great example of many.
And this is really one of the ways that we're trying to help people. It's lifestyle. It's not just the treatments we do here, but we're trying to get people to look at their health in a different way. Don't try and put yourself back together. Try and keep yourself up running as best you can. And Mark is a shining example of that.
Now, we're literally out of time, Tom, but I wanted to ask you, before I let you go, you and your practice, Charm City Integrative Health here in Baltimore, Maryland, have certainly established a reputation for excellence. You're one of this region's top integrative health and wellness experts. I just wanted to ask you what you feel helps separate you and your practice apart from the others.
A dedication to helping people. We did this not because we had to, but we wanted to get a group of treatments together that would really reach out and get as many people feeling better as possible.
And I love the integrative approach you utilize. I love the fact that, as we mentioned earlier, each of your primary treatments and therapies that you all offer to your many patients really are not only helping them achieve their maximum results, but also that you offer them in a customizable manner for each of your patients, because you realize the importance that each patient is different.
Yes, definitely. If somebody wants to come in here and just use one of our services, we're more than happy to do that. People that really want to take their health to the next level, we're happy to help. We're happy to put together a package that makes sense to you.
Yeah.
And we can alter it as your needs change.
Well, on that note, we'd like to thank you, Tom, for joining us, being our expert and educating us and enlightening us. It was a pleasure having you on, and we'd love to have you back on in the future.
Oh, I'd love to be here. Thank you very much.
Thank you.